All right, today we are breaking down a true medical emergency, one that can unfold in just a matter of hours but really stems from years of dependency. We're going to dissect a life-threatening condition called delirium tremens. Let's dive right in.
So let's jump straight into a scenario. I want you to imagine you're a first responder. You get on scene and you find a 55-year-old man. The story is he quit drinking 4 days ago, and now his body is in absolute revolt. He's confused, agitated, he's just drenched in sweat, and he cannot stop shaking. Now, this is not just some bad hangover, this is a full-blown crisis. So the question is, what is happening to him?
To solve this medical mystery, the very first clues are right there in the vital signs. These numbers, they tell a really dramatic story about the chaos that's happening inside this patient's body.
Okay, let's break these numbers down, because each one is telling us a piece of the story here, a story of a body in crisis. A blood pressure of 180/90, that's severe hypertension. A pulse of 120 is tachycardia. His heart is just racing, and his breathing is rapid and shallow. When you put it all together, this isn't just a body under stress. It's a body whose core systems are being pushed to their absolute limit.
So when you put all these pieces together, the timeline, the symptoms, those wild vital signs, you arrive at a very specific and incredibly serious diagnosis. We are looking at a case of delirium tremens.
So what exactly is this? Let's be really clear. Delirium tremens, or DTs as it's often called, is the most severe form of alcohol withdrawal. It is a medical emergency where the body and brain, which have become dependent on alcohol, are suddenly deprived of it, and they just spiral out of control. The key words I want you to remember here are severe and potentially fatal.
And this timeline is absolutely crucial. It shows us exactly why our patient's situation is so critical. See, DTs don't usually hit right away. They typically pop up around 48 to 72 hours after the last drink. Our guy, he's at 96 hours. That's 4 days, which puts him squarely in the high-risk period for this really dangerous complication.
Now, I want you to just focus on this number for a second. It's a stark, sobering figure. It represents the literal life-or-death stakes of this condition. 15%.
Yep, that's the potential mortality rate. And you might be asking, why is it so high? Well, it's because the extreme stress on the body can lead to things like cardiovascular collapse, respiratory failure, or severe infections. The body's systems, they just start to shut down under the strain. This is why recognizing the signs isn't just important, it can be the difference between life and death.
So if you want to treat DTs effectively, you have to understand the full spectrum of symptoms. This is all about recognizing the many ways the body is signaling that it's in a state of emergency.
And the signs are dramatic. The patient has this profound confusion and agitation. The tremors we saw in our case study, that's a classic sign. The body can spike a fever, start these drenching sweats, a condition called diaphoresis, and then you have these terrifying hallucinations. And we're not just talking about seeing things, but often experiencing deeply frightening visions. Seizures are a very real risk, and the whole thing is driven by something called autonomic hyperactivity.
So what is autonomic hyperactivity? Well, it's a pretty simple concept with really dangerous consequences. It just means the body's automatic fight or flight systems are basically stuck in the on position. This is what's causing that high blood pressure and the racing heart we saw on the vitals slide. The body is in a constant, absolutely exhausting state of high alert.
Okay, so we've identified the problem. We know it's a life-threatening crisis. Now what? What's the plan? Well, the first response playbook is all about stabilizing the patient and, most importantly, preventing harm.
There are 5 immediate goals. First, protect the patient from injury. They can be confused, agitated. Second, support the ABCs: airway, breathing, and circulation. That's always fundamental. Third, check their blood glucose. An altered mental state can also be caused by low blood sugar. Fourth, get IV access so you're ready to give medications. And finally, monitor the ECG, because DTs can trigger some very dangerous cardiac rhythms.
In the middle of all this high-tech medical care, there is a profoundly human element that is just so crucial. The source material really emphasizes this. Simply trying to keep the patient calm, oriented, and reassured is a key part of treatment. Managing that agitation and fear can be just as important as any medication you can give.
Now, just as important as knowing what to do is knowing what not to do. There are a couple of common misconceptions in treatment that can actually be incredibly dangerous.
This is a big one.
The impulse might be to just sedate a confused and agitated patient. But that's a mistake. And why? Because sedation can actually mask other developing neurological signs. The goal here is to find the cause of the confusion, not simply cover it up.
And here's another crucial distinction. Benzodiazepines are powerful drugs, but their role here is very, very specific. You don't give them proactively to try and prevent seizures. You use them to terminate a seizure that is actively happening. See, they work by boosting the effects of a neurotransmitter called GABA, which you can think of as the brain's own braking system. It helps calm down all that runaway electrical activity that causes a seizure.
So, what's the ultimate takeaway here? Delirium tremens is so much more than just a list of symptoms. It's a terrifying look at how a substance can physically hijack the body's most basic functions. It reveals that dependency isn't just a choice, it's a profound biological change. And really, it's a stark reminder that the battle to break free from addiction is not just psychological, it is deeply and sometimes dangerously physical.